Your pelvis is the core of your whole body, and many issues can develop in this area, especially for women. These problems can be emotionally and physically challenging, ranging from inconvenient to debilitating. Joining me now is Adina Leifer, a physical therapist at Norwalk Hospital's Pelvic Health Center. Welcome to Connecticut Style, Adina.
Hi, thank you.
First, let's talk about how many women in the country are affected with pelvic health problems.
So it's kind of hard to really say. I think this studies show about 64% of women are really have problems, but in truth, I think it's almost everyone, whether they've had children or did not have kids. I think almost every woman at some point in her life has some sort of pelvic problem.
So let's talk a little bit about the Pelvis Health Center.
Yes, so that's part of Norwalk Hospital, and basically what we try to create is a center where women and also men can kind of go to their doctor and talk about openly their bladder, bowel, sexual, pelvis, issues that they have, and their doctor can kind of guide them in the right place, and instead of saying, okay, you definitely need, surgery, or you for sure need pills and stuff like that. Here's a chance to kind of do physical therapy, exercise, kind of retrain those pelvic floor muscles to kind of work better. And then from there, maybe you'll still need, surgery, but at least you're a much better candidate.
Sure, that makes sense. So let's talk about some of the services that you do provide at the Pelvic Health Center. First is pelvic health therapy. That's what you specialize in.
So that's what I do, exactly. I am a pelvic physical therapist, and what I basically do is work with patients on their pelvic floor muscles. So people don't even realize they have, muscles there, and that those, muscles help you hold in urine, help you hold in bowel, and then we kind of teach them where those are using biofeedback, and that's a tool that shows us what our muscles do. We kind of attach leads, and I kind of say your arm, you can kind of tell what your arm muscle's doing. I could raise my arm and I see my bicep working, but your pelvic floor you don't really see because it's all internal. So it kind of gives a EKG readout, and you could see what your muscle activity is doing, so you know if you're doing that famous Kegel right or if you're doing it wrong.
That's interesting. I guess people really don't even realize there's an issue there.
Exactly.
They're in pain, right? Another issue that you cover there is bladder and urinary incontinence. It's a big problem. It's a little embarrassing, but...
Yes, I think it's an area that almost everyone has a problem with, but no one really talks about. There's kind of two ways, and two ways people kind of have problems. One is kind of a stress incontinence, where they cough, laugh, sneeze, jump, and urine leaks out. The other is you kind of get that emergency, I have to go to the bathroom or I won't make it, and they have a accident. So we kind of deal with both of those, and a lot of it involves lifestyle, training to kind of get your bladder and pelvic floor to work better, strengthening. And the other is also health in terms of eating correctly, not having foods that kind of trigger that emergency, get me to the bathroom.
Got it. Something else you specialize in, you said, is sexual dysfunction also.
Yes. So the, pelvis is all a muscular area. So you could be too weak or you could be too tight. And usually sexual dysfunction comes if your pelvic floor muscles are too tight, and that's when people have pain when they have sex. And I feel like that's a really important topic that most people don't even talk about or know about, but I think a lot of women have that issue, and it really is a matter of, just like you'd get kind of a cramp in your neck and a pain in your neck muscle, the same thing can happen in your pelvic floor muscle. So we kind of work with that to kind of stretch and also strengthen the muscles.
Then just in general, pelvic pain, there are exercises, or what do you do in that case?
Yes. So for pelvic pain is kind of that similar issue in terms of the pelvic floor muscles are too tight. Just like you would have a neck spasm, you could have a pelvic floor muscle spasm. So what we do is kind of retrain it. And although we teach that, Kegel to kind of exercise and also, strengthen, I also teach that reverse Kegel to kind of lengthen the pelvic floor and kind of teach a relaxation to kind of take out some of those spasms.
Okay. And then lastly, for men, post-prostate removal, you have to exercise that as well,
actually, I feel like is become my specialty, but after which is so crazy. But after men have prostate cancer and they have their prostate taken out, they oftentimes the prostate holds up like a cork to kind of hold that bladder in, and then when they don't have that, they really leak urine. So the pelvic floor muscle is the only support that they have, and they're often told by their doctor, okay, just exercise, but they don't really know what that means. And they walk into my office and I've been doing this Kegel, and they squeeze their whole body, and I'm like, that's not how you do fluid and just retraining the muscles to give them better continence after they have their prostate taken out.
Dina, thank you so much for the information.
Thank you for having me.
It's a great resource at Norwalk Hospital. We'll put the information up on the screen there. You can simply visit norwalkhospital.org and find everything you need there. Coming up next, let's head over to the kitchen. Chef Maria shares her delicious recipe for grilled sea scallops when Style returns. We'll be right back.